My name is Thomas Brennan. I'm a reflexologist in private practice, and today's topic is reflexology is not Western medicine. I think we probably think that's pretty obvious, but there are some confusions that I would like to address. The first thing that I'm going to speak about is really context, and that is my own practice. In my practice, the way things work out, the people who come to me, pretty much 90% of the people who come to me are also, in one way or another, either under medical care or work in a medical context. I'm mentioning that because one of the confusions or one of the concerns is about reflexology competing with Western medicine. I don't find that to be true in my work. What I find to be true in my work is that there's almost no relationship. That the people who come to me for what they're getting out of reflexology, and then most of them have some relationship with a practitioner of Western medicine. And they do that pretty freely for other purposes, which they're not thinking about reflexology for. I'll begin with the body of my lecture. Reflexology is not Western medicine. As I said previously, pretty obvious. But there are some confusions, at least I perceive there to be some confusions. The most important piece of information here that's the basis for both confusion and not being confused, is that these two things, reflexology and Western medicine, are different paradigms. I wrote down a definition of what a paradigm is. A paradigm is a set of assumptions, concepts, values, and practices that constitute a way of viewing for the community that shares them, especially in an intellectual discipline. So, to the degree that it's something we think about, Western medicine has its own worldview and its own precepts and thoughts and procedures and everything. It's not, Western medicine is one thing. Reflexology has its own worldview, and the two do not really cross. If we really look at them, they do not cross. So one of the things I wrote down here was insidious confusions. That's because from my point of view, among the reflexologists who are working, who I know and have talked to, and the students I have worked with, there can be a kind of a confusion which kind of slips by the discrimination. Both of these things, Western medicine and reflexology, or reflexology and Western medicine, are within the worldview of our culture. And so, as reflexologists, one of the things that happens is when we're thinking about our work or thinking in our work, we can slip into thinking inside of the worldview of our culture. And that worldview of the culture is not reflexology, but it's a very easy slide to start thinking inside of the worldview or paradigm, general paradigm of thinking for the culture. And I think that's how the confusions occur. So, I'll get right to what the confusions that I see that are important are. One of them is, we as reflexologists, it's fairly common to hear about reflexologists who make medical diagnoses. That means it's fairly common for a reflexologist to be working on a person's feet, and while working on the feet, find something in one reflex, whether it's the reflex for the colon or the kidney or the heart, and say to the client, oh, you better have that checked out by a medical practitioner, or you have a disease. It could be liver disease or prolapsed colon or God knows what. It is fairly common for reflexologists to make those kinds of statements. One problem with making these kinds of statements with a reflexologist making a medical diagnosis or even suggesting medical diagnosis is that unless we are actually trained medical practitioners, it is outside the scope of our practice. We are not practicing Western medicine. And as soon as we make a medical diagnosis, we have walked away from the substance of our work. The substance of our work in relation to medical diagnosis is that medicine makes its diagnoses using the tools of Western medicine, tests like blood tests or other kinds of tests like MRIs and X-rays and so on. That is all Western medicine. And we, as practitioners, unless we are specifically trained in those things, do not know about those things. What we know about as reflexologists and how we stay inside of our work, what we are actually doing, is instead of making a medical diagnosis, what we do is examine the reflexes. And instead of making a leap, oh, the reflex is this or that, oh, you have celiac disease, oh, you have heart disease, whatever it is. What we can say, because we're reflexologists and what we're doing is examining the reflexes and then working on the reflexes, we can say there is congestion in the reflex for small intestine, heart, kidney, whatever it is. When we do that, we are staying inside of our work. The second problem with this medical diagnosis is as we walk away from our work. Our work as reflexologists is that we work on the reflexes. We use the press and release technique, which is, there are various ways that's taught, but essentially it's our press and release technique. We have our knowledge of the reflexes. We work on the reflexes with that. And so if we find a problem in the reflexes, it's our job and our work to clear that congestion in the reflex. And unless we are otherwise trained, we do not know that that congestion in the reflex specifically corresponds to a medically diagnosed disease. That is not our practice. That is outside the scope of practice for reflexology. So that then my biggest concern with that is our work as reflexologists is really important. My point of view is that the reflexology work that we do is important. And when we walk away from that, meaning if we find something and then jump from our paradigm to thinking in the culture's paradigm or thinking in the Western medical paradigm, we have left behind our work and we are losing some of that value, some of the importance of that work, which is really has meaning for people and it changes people's lives, but only to the degree that we stay inside of our work and refrain from going outside, either trying to treat a medical condition or diagnosing a medical condition. So as long as we stay, okay, this reflex, colon reflex, whatever, is congested and we're familiar with different types of ways that the congestion shows up, then we work on that reflex and clear away the congestion in the reflex. And that's I know it's possibly a very simple description, but that's the discipline, staying inside the paradigm of the work. The second major class of confusions that I find among reflexologists and among people who have been my students is believing a medical diagnosis. Now, this is also something which is an easy slide. Our clients will come to us and they will, not only are they going to in many cases want a medical diagnosis, but they will come to us with either a diagnosis by a medical practitioner or their own self-diagnosis, which will be inside of the paradigm of the culture and possibly their interpretation of medical diagnosis. So people will come and they will describe their condition that can be subtly distracting and pull us into the paradigm of the culture, or if they've been to a medical practitioner, pull us into that paradigm. So the believing of a medical diagnosis or self-diagnosis. My understanding of what to do with this is it's a story. People are telling a story which has meaning to them and perhaps value and emotion. And there are some facts in that story. My job, I'm a reflexologist, somebody comes to me and says, oh, I was recently hospitalized with a disease, a kidney disease or an adrenal disease or something like that. And the surgeon said this and the other practitioner said that. The surgeon says, well, we can take it out. And somebody else says, well, you might recover on your own. And they described it as some kind of a specific disease that they looked at with an MRI and that sort of thing. The moment I start to believe that that is the fact, now those are actual facts, but when I believe them as the facts, what can happen is insidiously I'm in the medical paradigm. What's really true is there may be facts there, but my job as a reflexologist is that I examine the reflexes. The reflexes then tell me something. If my client is the patient of a medical practitioner and they are describing what the medical practitioner said, number of things there, facts, and very unlikely that my client actually completely understood what the medical practitioner was saying. So it's retranslated, and it's a story. I'm looking at the reflexes. The reflexes are going to tell me a different story, and my paradigm is going to tell me a different story. With regard to this, believing the medical diagnosis, which includes self-diagnosis, the story I want to believe is I actually examine the reflexes. In my case, primarily foot reflexology. So I'm examining the person's feet, and those reflexes, thousands and thousands of times I've examined people's feet over many years, I'm looking at them and they are telling me something. They're not telling me a medical diagnosis, it's not Western medicine, they are telling me about the reflexes. Then the thing that follows is that I work on those reflexes and I resolve the congestion that I find in the reflexes. I am not thinking, oh, this is, kidney disease or jaw infection or high cholesterol or something. I'm thinking, that's the story I was told. What I find in the reflexes is first the story that reflexes tell, and then I'm using the reflexology paradigm, the way that I think about reality and life and illness based on my knowledge of reflexology. And the value that comes into people's lives through the reflexology is important. And if we start believing another story and treating that story rather than treating what we find in the reflexes, we have diluted and distracted the work of reflexology. The value we can bring, which is really significant value, is the value that's done through the work of reflexology. Thinking in terms of reflexology, examining the reflexes, and then resolving what we find in the reflexes. As a conclusion, I will say that I really do understand that as many reflexologists as there are, there's that many opinions about what reflexology is and how to practice reflexology. That's one of the beauties of the work, that there are so many different possibilities, and that the fact that there are so many possibilities about how reflexology can be practiced makes it available to a larger number of people who then can be helped in a wide variety of ways.